Hi, this is Dr. Sayed Quadri. Today I'm talking about again another important topic, seasonal affective disorder. This is that time of the year now. It's October. It's the fall season. This is the time we enjoy somebody who likes to go traveling, love to go and see where the leaves are changing colors, and some people really enjoy this time of the life time, and then they enjoy the nature. But for some, it is a troublesome time where fall can be detrimental for them in terms of their mood. This is the time where their mood starts dropping, and then they a lot of the depressive symptoms starts coming. So in my clinic, I've seen patients who are depressed or anxious been coming to my clinic. This is their difficult time for them, the fall and the winter. And the holidays, it's a very difficult time for them. So let's look at what some of the things I've seen, what causes this to happen. So as you know, this is the time you have the days are shorter, so we are less exposed to sunlight. Especially if you work indoors, you're not exposed to sun as much, and that will cause deficiency in vitamin D. And then of course there's that change in your sleeping habits, and then so that affects your sleep. Also, there's a change in serotonin and melatonin levels going on. There's a chemical imbalance. Already, if you are depressed and anxious, that you already have a chemical imbalance, the winter or the fall season may exacerbate these chemicals. So that's kind of what I see happening in a lot of my patients. What I've done usually with my patients, I've kind of seen them, evaluate them, get them prepared, educate them, and prepare them, and then tell them things like we need to go outdoors more early in the morning when sun's available. If they cannot do that, they can also buy a sunlight where they can be under it during the daytime or whenever they're there by their computer. Also, then I've made some med changes if they're already on medication to help with that. One patient I have seen who struggles with this disorder, I have given them like some leniency in their work and given them what they call FMLA, medical leave of absence. If they're struggling, if they need to come back home or they need extra time, they can use that to extra help. Overall, it's a disorder that can be managed, and it's treatable with little changes in their lifestyle that can also help, like exercising, sleeping on time, eating healthy. These are some of the other things I've recommended my patients that help them when they're struggling with this time of the year. I hope this helps. Thank you again. This is Dr. Quadri, your partner in emotional health.